day, and welcome to our introduction to holistic nursing for nursing students. My name is Vanessa, and I am a recent graduate of Augusta University in 2023. And
I'm here, Catherine, and this is my home. I tried to decorate the TV a little bit to get some lighting. We're not professional people. I've been a holistic nurse for 25 years, and I've been a pediatric nurse practitioner for longer than that. So we're going to tell you a little bit about what we think about holistic nursing and how we think it impacts our practices and where we'd like to go. So come along for the ride.
okay, so can you tell me exactly, Dr.
You can call me Catherine. We are colleagues.
Dr. Kathy, can you tell me what exactly holistic nursing is?
Yeah, I'm going to take the opportunity to go directly from Dossie and Keegan's Holistic Nursing Handbook for Practice. And there is a particular chapter written by Carla Mariano, who essentially says that all nursing practice that heals is about healing the whole person as a goal. And there is a difference between healing and curing, and holistic nursing looks at it from that perspective. There are some major areas that holistic nursing focuses on that makes it somewhat different than what you were taught in nursing school, including that caring, healing relationship. Self-care now is part of the nursing standards, but it's been part of the holistic nursing standards for as long as I can remember. We really look at, again, a very wide view of what a patient is. It's not just a patient with a medical condition.
Okay, so with what you just said, what does it actually mean for a nurse and nursing care?
Well, first of all, it's important to understand that holistic nursing is founded in nursing theory, and there are a number of nursing theorists, which I won't go into because most people glaze over when you start talking nursing theory, but they really look at caring models and mind, body, spirit. And when you look at the nursing process, the holistic nursing process includes one extra step, which is looking at patient outcomes, so that when you develop that plan for your patient, the patient is involved in the whole conversation. It's not just we dictate what we want you to do. So that makes it very different than what we were taught in school.
Yes.
There is a focus in nursing school on therapeutic communication, but holistic nursing looks at a therapeutic communication with some additional pieces as part of its core value. We're certainly into education and research, part of the reason for the video, and holistic nursing has a very strong foundation in its core in looking at evidence-based research for practice. And finally, it's looking at self-reflection,
Okay.
so that you do self-care and self-reflection and continue to grow.
Can you give me an example of how holistic nursing has helped you in your practice?
Yeah, I took care of children with chronic conditions, most of them life-shortening chronic conditions. And so it was a way for me to really look at the patient and the family from a big picture point of view. We oftentimes are very quick, particularly nowadays, to get patients in and out, and we miss sort of looking at that whole patient and recognizing that there is a mind, body, spirit connection, and that we're all one and that we're all connected by energy as a way to really care for a patient. The other thing I think that makes holistic nursing different or enhances a nursing practice is it focuses on being. So as I teach my students in their very first health assessment class, nursing school is all about doing. We have to learn how to program those pumps and change those dressings and do sterile techniques. Holistic nursing is about being present, reflecting. I like to say reading the room, feeling the energy. So it's a way of finding balance.
Okay, so as an up-and-coming nurse, just graduating, what can holistic nursing do for me?
I think it brings you a certain level of satisfaction in caring for your patient that you don't get when you're in nursing school. Because again, we're so focused on memorizing pharmacology and med-surg and how do you hear those heart murmurs. This is a way for you to really care for a patient and a family.
Okay.
So I'll give you an example, a very simple example, which was a mom who had her very first baby, was in the children's hospital. The baby was only a couple months old and actually had botulism, which caused this baby to be very low muscle tone, wasn't able to feed. And so the nurses are all focusing on looking at that physical assessment.
Yes.
And of course the mom looked very worried. But because I was able to sit with her for a few minutes, I said, "Tell me how you're doing." And she let out how worried she was about the baby's birth certificate that was in the wrong name, so they couldn't get any support services. And they lived paycheck to paycheck and put their money in an envelope and label it gas. Well, they lived 40 miles away. They'd used up their month's gas, so Dad couldn't come to see the baby. And these were what were really worrying her. And unless you stop to be present, which is what holistic nursing teaches, and looks for that balance, you would have missed all of that. So we were able to, really provide her the support services that she needed in a way to help relieve that anxiety and put some balance back so she could focus on her baby and her family.
Okay, that's awesome. That's one of the things that sparked my interest in holistic nursing. I want to get that whole picture. I want to have something in my arsenal other than medicine that can help relieve the pain, the anxiety, to, like you said, be present in the right now.
Right.
And to be an effective nurse. I just don't want to come in and just be like, okay, this is your meds, I'm going to flip your pillow. No, I need for you to know that you're my number one person.
Right. And I think that's the foundation of holistic nursing, is looking at that mind, body, spirit connection and making that present, being present with that patient. And you begin, as you get more into the practice of holistic nursing, adding modalities that complement Western medicine. So I use a lot of guided imagery. I use a lot of deep breathing with my patients, but there are so many other things that can, again, be brought into your practice that then support patients as we go along. So let me make sure we got the other questions, because we kind of got together to make some questions. And what's your expectation from the association, from the American Holistic Nurses Association?
Well, the biggest thing to me is a mentorship. I'm coming in, I am so excited, but I need some guidance. So to have a mentorship program, it would be excellent, even if it was on the chapter level, just to have mentorship to guide me along the way so I know which way. Vanessa, you don't need to go there. We already went there. Let's go route this route. And so that's my biggest, I just need somebody to mentor me.
And I think that with the networks that we have within the Holistic Nursing Association, there are ways where you connect with the people that have shared interests that will support you and encourage you along the way. So I hope that this was a good introduction to what holistic nursing is about and can do for you in your practice, and we hope we'll do more of these.
Yes.